Good afternoon, everybody. This is February 18th, 2021. I'm Gary Pace, the Lake County Public Health Officer, and this is the one of our weekly COVID response updates. Sarah, our epidemiologist, is not able to be with us today, so I'll go over some of the slides that she normally shows. So overall, we're doing quite well. We are continuing to see good improvement in the number of cases and sort of no real problems in the hospitals right now. And we are still working with the vaccine clinics, and I'll go into quite a bit of detail about that. But let's go to the slides. So if we could put those up. This is the slide we look at each week, which shows the new tests. Well, how many tests are being done in California, and you can see the number's still quite high, although it is dropping a little bit. So we seem to be testing a bit less than we have been before, but there's still very good testing going on. And on the right side of the graph here, of the slide here, is the test positivity rate in California. It continues to fall. It's down to 3.9%, which is quite low. Really, it hasn't been this low since June or something like that. So this is very reassuring that things are going in the right direction. Next slide, please. So this is again the positive cases on the left-hand side. So again, the drop is very dramatic. We're getting down now to the numbers we saw back in July. We still are seeing improvement. Now this is in the state of California. On the right, the slide on the right is the hospitalized patients. So that number is also improving, although not quite as good as the case rate, which is what we would expect. Next slide, please. Again, this is California. So on the left is the ICU patients continuing to fall. And on the right is a really important one. This is the death rate in California. Still dropping, but still very high. There were 400 deaths yesterday in California, and we're still not at the level that was very concerning back in July. So, but we're seeing this drop, and with the case rate dropping and the positivity rate dropping, we should continue to see improvement in this. Next slide, please. So this is Lake County. What we're seeing here in Lake County is some improvement in the cases over the last week. We saw a dramatic drop from mid-January from the response over Christmas and New Year's. Now it seems to be starting to slow down a little bit in its improvement, but it's continuing to get better. So we really need to get to below that purple line to get to where we can open up in the red tier, and we still have a ways to go. We're still about a little over twice that rate right now. We have 121 active cases and 39 total deaths in the county that were COVID related. Next slide, please. So this is, again, the tiers around California, and the vast majority of California remains in the purple tier. We are still in the purple tier, but and we still have a ways to go to get into the red. Our testing positivity rate is consistent with the red tier, but our case rate is still pretty high. We're at 20 per 100,000. We need to be down to about 7 per 100,000. Next slide, please. This is about the vaccine. So we are continuing to roll out the vaccine. About 8,100 residents have received at least the first dose of the vaccine, which is really good. We're seeing some good uptake of it. About 13% of the total population in the county, and to get the vaccine, you have to be 18 and older. So 16% of that population has gotten vaccinated now. And there's about 2,000 folks that have actually had their second dose. Next slide, please. So this shows some of the demographic information. And it's going to be a little bit confusing, but this is up on the state website. This is from the state site now. And so this is available to you, and you can check on it periodically. It's on the California Department of Public Health website. The very top one, the very left side, is the ethnicity. And the very top one, 0.4%, is the American Indian or Alaskan Native. This is lower than I think it really than the real value is. We've talked to tribal health, and they are in the process of trying to correct some of the data problems. It seems like some of their data is not getting picked up by the state, and so they're working on that now. But I think we're going to see that that's quite a bit higher. The Latino numbers are 9.8%, which is uh, about 20% of the population is Latino. And so we're seeing half of what we would expect just from the population. And the number of cases in the Latino population is about twice what you would expect for their population. So really, we should be getting much more coverage within the Latino community. And so that's something we're going to be working on in the next few weeks. Multi-race is the next one down. And that one's a little bit confusing because I think some people have gotten categorized in that category that probably more typically we categorize in a different group. So I'm not sure exactly what to make of that now. We're trying to understand that. And then 62% of the folks are identify as white. The age rates are on the upper right-hand corner, and about 2/3 of the people that have been vaccinated are in the 65 and above, which is what we would expect by the way we've been rolling this out. The male-female distribution is there. And I think that was the last slide, right? Yeah. So you can end the share now. Thank you, Sam. So what those show is that we are continuing to see improvement. Our numbers of the case rates about 20 per 100,000. We need to be down, about 7 or so to get to the red tier. We are definitely in the case rate where the elementary schools can open. The middle school and the high schools have to wait until we're in the red tier. So let's talk about the vaccines. There's a lot happening in there now. There's a lot of changes going on. Most of them are coming down from the state. And I just want to go over it a little bit just so people can have some understanding. And then at the end, we'll talk specifically about how to get appointments and things. So if this is boring to you, go ahead and skip over to the end. We have a new drive-through setup that started this week. So previously for 6 weeks or so, we were doing indoors, but because the numbers are increasing, we wanted to get it outdoors so that we weren't at risk for spreading COVID and just to have enough capacity to expand as much as we could. The drive-through in Lakeport is at the Drive-In Theater on Mondays and Tuesdays, and in Clear Lake, it's at Redbud Park on Thursdays and Fridays. It's going really well. The setup's been good. We can expand quite a bit at both the sites, and so far so good. The weather's cooperated, and the team that planned this did a great job. We've got a fair amount of staff, both paid and volunteer staff, helping us, and so far so good. The main issue is that we don't have enough vaccine yet, and again, the amount of vaccine is starting to increase a little bit. But the problem this week is that with the bad weather that's been happening across the country, we have not received our shipment for this week. So we have somewhere over 1,000 doses that have not left the warehouse yet that we thought we were going to get on Tuesday. So we've had to cancel our Thursday and Friday appointments for the first doses that people were scheduled to get. So if you were scheduled for Thursday and for today and tomorrow, basically, for your first dose, you're not going to be able to get it this week. We're going to try to reschedule you for next week. If you should have gotten a phone call by now, but if you haven't, just wait for it. It's coming, but don't plan to come in tomorrow if you were coming for your first dose. This is really unfortunate because we were moving along so well, but there's not really much that anybody could do about this right now. The weather's been really bad. Our supply that we had gives us enough to do the second doses that were scheduled for today, Thursday, and tomorrow, Friday. So if you had an appointment for that, go ahead and come on in because we'll be able to get that for you. And then we're basically empty. So what we're doing is we're waiting to see when we can get this shipment in. I'm hoping it'll be this weekend, but it really is all dependent on weather. And if we get it this weekend, then we will start scheduling people again next week. At this point, we don't have any appointments scheduled because we don't have any vaccine. And we don't want to start scheduling people and then the shipment doesn't arrive. So we're just playing it by ear at this point, waiting for the shipment to come in, and then we'll open up the appointment slots for everybody next week once we get some more vaccine to work with. So again, the new drive-through is working well. The inventory is a big question right now because of the weather problems. Once the vaccine does come in, we're going to have a lot of vaccine, and so we're probably going to try to really expand the site so that we can get things going and kind of get back on track. Um, we did try a new scheduling platform that the state is pushing everybody to take part of. It's called My Turn. And this is going to be the site that the state says everybody has to use in the near future. We were getting on the site, we were starting it for Tuesday, and there were a lot of problems with it. They don't have a lot of the kinks worked out. And so we stopped it, and we're going back to the previous scheduling strategies that we were doing before. A lot of what was happening is they didn't filter people out that didn't live in Lake County. So an awful lot of the appointments that were scheduled for Tuesday were people from out of county. They were from the Bay Area and things like that. And we had to stop them and turn them back around. The state was supposed to cancel them, but it didn't happen very well. And it was a pretty unhappy situation for people that had driven very far. But we really committed to saving the vaccine for the folks in the county. And now it's really good that we did, because we didn't get the shipment to come in either. So at the current point, the scheduling is going just the way it did before. Once we get some vaccine, we'll open up the scheduling platform. We'll put the links on the website. You can go to the website, get the link, and make the appointment. So just to kind of go over this again a little bit, the second appointments have been moved around a little bit because before we were at different sites and different days. So if you got your first shot a month ago, we want to get you in as soon as we can. If you were scheduled Thursday or Friday, you should be able to get your appointments, but you won't go back to the same place you got the original shot because the location is moved. And it's possible it's going to be a different day. If you went on a Thursday, you may be coming in on a Friday this time. So there's a press release that went out yesterday that has a lot of this information on it, the specifics on it, or you can contact 211 or the Mohawk call line and to get some help with that, because it's kind of confusing because of all the changes being made. And so we really want people to understand what's happening. But if you do have an appointment tomorrow, it's going to be at the Redbud Park in Clear Lake. If you do not have an appointment, please don't come. We don't have any vaccine for anybody that doesn't have an appointment. And the first doses, like I said, are basically canceled now until we get some more vaccine. So next week, we're basically awaiting the shipment. When it comes, we'll put the links up and we'll get people going as fast as we can. And we're hoping to set up for some really big clinics next week to catch up. In terms of the tiers, we're focusing still on the elders, 65 and older. Food and ag is people that we want to get going in the near future. We've tried a couple ways to do that, to organize that, and we're still working on how to make that really successful. But we are very interested in getting the ag workers and the food workers vaccinated in the coming weeks. Folks with medical issues, there's been a lot of question about people under 65 who have chronic medical issues and when they can get vaccinated. They're definitely a high-risk group, and the state just came up with a recommendation a couple days ago that those folks can starting March 15th. So there's specific conditions that are listed, and people will really need to get their medical provider to help them see if they're qualify or not. But you can also go on the state webpage and see what the specific conditions are for that. But those folks will start being able to get vaccinated starting the 15th of March. Now, a lot again depends on how much vaccine we have and how well widely available we'll be able to make it, but at least that's the state's giving the green light at that point. Other groups are a big question. You know, previously there was a lot of listing in the state guidelines about essential workers and other folks when they were going to be able to get in the line, the group 1C and all that. But it looks like now they're probably going to switch to a more age-based approach, which is, so once we get through some of these groups I just mentioned, that they'll probably just go to doing certain ages at a time. So age 60 to 65 next, and then 55 to 60 next. So we'll see how that goes, but that's kind of the way they're talking about it now. The ethics committee did meet again this week, so they had their second meeting. It seemed to go well. I spoke with them for a little bit, and then I leave, and then they talk about things and make some specific recommendations. Really, what they're trying to do is to help us decide. People are writing me all day or sending in requests about, well, what about this group of people? What about this group of people? When do they get in? How come you're not doing this group of people now? And this group is another. They've got some medical professionals and some folks from representing the Latino community, some folks representing the Native American community, and somebody that's representing the business community, and they're helping to give a broad overview of what their thoughts are, what's best for the county in moving forward with prioritization of the vaccines within the context of what the state is allowing us to do. So it's a really good thing, and so far it's working really well. If people have a specific request or something that they want their group to consider, you can send in an email to the MOAC email line. You need to keep it under 200 words and be pretty specific about what you're thinking about, and they'll look at it and potentially take it under consideration. So, that's basically it for today. Very complicated with a lot of the things going on with the vaccine sites and how we're going to be able to manage it. And the biggest disappointment this week is that our shipment didn't arrive. And so we're basically going to use up our last drop of vaccine by tomorrow afternoon with the second doses that we had already planned on. But hopefully it'll come in over the weekend and we can get things started again next week. We're really working hard to get the vaccine out as fast as we can and to get it in people's arms so that we can get closer back to normal. One of the things that's really interesting about the vaccine is that, we were really struggling with the nursing homes before, and that's where like a third of the deaths have occurred in Lake County. At this point, all the nursing home residents have been vaccinated, and there are no cases in any of the nursing homes in the county right now. So it's really kind of changing the whole nature of what it's like there. We can start allowing some visits and we can start allowing some activities, and we're starting to move forward with loosening things up and having more of a normal life. And I think that's a snapshot looking into what we may be looking forward to in the coming months. But it's the more people that can get vaccinated, and the quicker we can get the vaccines to people, the quicker we'll be able to get there. So if you're having hesitancy about it, or if you're having second thoughts about it, we really encourage you to look into it a little bit more, because the sooner we can get the vast majority of folks vaccinated, the sooner we're going to be able to get into a more normal lifestyle. So I think that's it for today. Thank you very much.